Gallstones are the most common disease of the gallbladder and occurs in about 6 to 10% of all humans. Statistics tells us sonography detects gallstones in over 15% of patients older than 60 years in the US. Stones in the gallbladder will reflect the sonic waves and produce an echo there, so that the gallbladder does not appear totally black. And we are going to search for them. The greatest risk factors for developing gallstones in all patients are female gender, estrogens like oral contraceptive therapy or even pregnancy, family history, obesity, and some diseases like diabetes, elevated serum lipids, cirrhosis, morbus Crohn, and so on. Also, rapid weight loss is a risk factor for developing gallstones. What are the complications of gallstones? In connection with gallstones, there's the risk for acute and chronic cholecystitis, acute pancreatitis, biliary obstruction, or even cholangitis. So, stones in the gallbladder will reflect the sonic waves, and that's the finding we are looking for. If the stone contains lime, no sonic waves will pass through it. Therefore, an acoustic shadowing will appear behind the stone, a black stripe on our screen. Stones will move freely within the gallbladder when the patient's position is changed. Tumors of the wall will not be moving, and this is how we can distinguish in between these two. Always remember the 3 criteria of a gallstone: echo in the lumen, acoustic shadowing, and free movement of the stone when the position of the patient is changed. Let's see. We find echo in the lumen over here. There is posterior acoustic shadowing behind the stone. And let's see if the structure is mobile. When the patient changed the position, also the position of the stone in the gallbladder changes. So maybe from a supine position to a standing position of the patient, we see this movement of the stone over here. And in this case, I ask the patient to roll over on the other side. And what we see here, also the gallstones in the gallbladder are rolling to the fundus of the gallbladder. So these are really rolling stones in the gallbladder. With this patient who is suffering from pains in the right upper quadrant, we at first cannot guess what the problem is. So we go on scanning. And what's mostly like to strike us is this acoustic shadowing over here. Where does it come from? Do you guess? When observing the shadow more closely, we notice that the source of this shadowing is the gallbladder, correct. We go on scanning, and we can see in this region there are gallstones causing acoustic shadowing in the far field. The problem is there is no bile more in the gallbladder, so we don't see the anechoic region of the bile, and only gallstones can be seen. It's a very tricky situation, but we will manage this. Over here, only gallstones, no more bile, a shrunken gallbladder over here. So the key message is, it's very easy to miss gallstones if there is no more bile in the gallbladder. We have to look for acoustic shadowing to find the organ and make the diagnosis. But we have to keep in mind, not every echo in the gallbladder means that there is a stone. Here too, it's essential to know the differential diagnosis for echoes in the gallbladder. Stones sink to the bottom, which means they are always found in the lowest segment of the gallbladder. Air, like we see in aerobiliar, rises and is always found in the uppermost segments. Bubbles of air cause a narrow, unsteady artifact in the periphery. We will see for this. As seen in this figure, stones will be shown in the lowest segment of the gallbladder, and bubbles of air rises to the uppermost segments. Tumors are attached to the wall of the gallbladder and will not change their position when we change the position of the patient. so we can distinguish in between stones and tumors. What are the causes of an acute cholecystitis? In 95% there are gallstones. That's the most common cause of the inflammation. But there are other causes for severe inflammation of the gallbladder. For instance, severe trauma, severe illness like septical conditions, or prolonged fasting on the ICU. What are the findings of an acute inflammation of the gallbladder? The thick wall of the gallbladder shows us its various layers. Already 3 layers will be visible. And moreover, some pain is felt when the gallbladder is touched or nearly touched by the transducer while we're doing the exam. And this we call the sonographic Murphy sign. So, we'll summarize the findings. The wall is thicker than 4 millimeters, layers of the gallbladder are visible, and there is pain during the scan. Of course, there are other clinical findings like temperature and blood tests, but these are the sonographic findings. If we see free fluid around the gallbladder, we know that the infection process has exceeded to the other organs. We also can see hypoechoic areas within the liver and maybe an obstruction of bile ducts due to the gallstone. We have to answer the questions. How high is the risk of perforation? Are there stones? Is there free fluid nearby? Now I've got a very beautiful case for you. It was a 50-year-old teacher, I think, with pain in the right upper quadrant, and I did the scan. You can see here is the gallbladder. There is a gallstone, and we have to take a more close look on the wall of the gallbladder. Here you can very easily detect the wall is thicker than 4 millimeters, and you see 2 bright layers and in between a dark one. This is the place where the edema and inflammation has taken place. I'll show you the next one, and when I increase the gain, you also see here, this is sludge or even pus in a very severe inflammation process of the gallbladder. So the next step, I try to test for the sonographic Murphy sign. I push the probe against the patient's abdomen in the region of the gallbladder, and this test was really positive. Patient complained about very intensive pain over there and was sent to the operation theater for a cholecystectomy. Very rarely there's something else than an inflammation when the wall is thicker than 4 millimeters. For instance, ascites, lack of proteins in the blood, or congestion of the gallbladder or hepatitis can be a cause of increased diameter of the wall of the gallbladder. So, like in this scene, the wall is more than 4 millimeters thick. There are 3 layers seen. But what's the difference? There's no positive Murphy sign, so it's no inflammation. Only 5% of patients with a severe inflammation don't have gallstones. These situations mostly mean a highly dangerous condition for the patient. The inflammation is caused by sepsis, trauma, or staying on the intensive care unit with a long-lasting fasting. Here is an example for a patient without a gallstone, but a very severe inflammation of the gallbladder. We are called to the intensive care unit to perform an ultrasound examination, and you will see there is enormous thickening of the wall. We can see very clearly the layers in between, showing the inflammation, showing the edema of this very severe inflammation. An acute inflammation without a gallstone.